Sphingolipidoses, that is the lipid storage diseases. We are continuing with the Krabs disease. So in case of the Krabs disease, the enzyme involved is nothing but the beta galactosidase, and looking at the lipid which is accumulating. Here the lipid which is accumulating is nothing but the galactosylceramide, and the features are nothing but the mental retardation is seen, as well as the myelin is almost absent in case of the Krebs disease. Next we are looking at the Gaucher's disease. So in case of Gaucher's disease, the enzyme which is affected, that is deficient, is nothing but the beta glucosidase. And what is accumulated? The lipid which is accumulated is the glucosylceramide. Previously in Krebs disease it was the galactosylceramide. Here it is glucosylceramide. And the clinical features, it includes the liver is enlarged, spleen is enlarged, there's erosion of the long bones, as well as there is the mental retardation is seen, and this is seen in case of the infants. Next we are looking at the NP disease, that is the Niemann-Pick's disease. So in Niemann-Pick's disease, the enzyme which is deficient is the sphingomyelinase. And then looking at what is the lipid which is being accumulated, the lipid accumulated is nothing but the sphingomyelin. And what about the clinical features? The clinical features includes the enlargement of the liver and the spleen, hepatosplenomegaly, and then there is the mental retardation, as well as other thing to note is that it can be highly fatal in case of early life. Next we are moving on to the Farber's disease. So in case of Farber's disease, the enzyme which is deficient is nothing but the ceramidase. Ceramidase is the enzyme which is deficient, and what is the lipid which is being accumulated is also a similar one, that is the ceramide. Clinical features include the hoarseness as well as the dermatitis. Next there is also presentation of the skin deformation and the skeletal deformation, and there is also MR, that is mental retardation, and it can be fatal in early life.